I am Dr. Sufi, and I'm a cardiac electrophysiologist at CVPH. Certain cardiac rhythm problems can be treated with a procedure known as a catheter ablation, which involves mapping the heart to identify and eliminate the area of origin of an abnormal heart rhythm. The following video depicts an actual patient undergoing catheter ablation for atrial fibrillation at CVPH. The purpose is to explain what the procedure entails and what the patient and family can expect before, during, and immediately after the procedure. This same patient also underwent a pacemaker implant a few months later. That video is also available here on the CVPH website. And now, on to the procedure. For outpatient procedures, the patient checks in upon arrival. After all the paperwork is done, the patient is greeted by a staff from the invasive cardiac lab and taken to the holding area where preparations are made for the procedure. This includes obtaining vital signs, placing an IV, possibly drawing blood, and hooking the patient to a monitor. From there, the patient is taken to the EP lab, where the procedure is actually performed. Strict aseptic techniques are adhered to in order to reduce the risk of infection. Local anesthetic is injected into the groin, through which catheters will be advanced into the heart. Sometimes a catheter is also advanced via the neck. Catheters are then advanced into the heart. Different catheters are used to record electrical signals from within the heart, to obtain ultrasound images, or to deliver radiofrequency energy to destroy tissue causing abnormal heart rhythms. Contrast is sometimes used to visualize some cardiac structures. A three-dimensional mapping system is sometimes used. Each red dot here represents a location where radiofrequency energy was delivered. Throughout the procedure, a nurse is constantly at the patient's side, monitoring vital signs, administering sedation as needed, ensuring patient safety and comfort, and periodically updating the family by phone. After completion of the procedure, the physician meets with the family in the waiting room to inform them that the procedure is over and to answer any questions. For outpatient procedures, the patient is usually transferred to the short stay unit, where he or she is observed overnight. Inpatients usually go back to their room in the hospital. Instructions for activity, medications, and follow-up are given prior to discharge.
I talked to Dr. Sufi. Everything went very well. He's pleased. So you're good to go.
I hope you found this video instructional. If you have any questions about this or other cardiac electrophysiology procedures, or would like to schedule an appointment, please contact the Cardiac Electrophysiology Center of CVPH.